Okay, so let's talk about urinary tract infections. Okay, so we're finished with pre-renal, renal, and post-renal kidney injuries. We're finished with kidney stones right now, and we're going to now focus on a new topic, urinary tract infections. Okay, so when we look at this slide, we really see that there's two main parts of the urinary system, right? So there's the kidney and there's the bladder. And of course there's the urethra, which allows the urine to exit, right? So the bladder and below is the lower urinary tract. The ureter and above is the upper urinary tract. So we typically refer to urinary tract infections as upper urinary tract or lower urinary tract because it's a bit important to distinguish between them. You're not that sick with a bladder infection usually. You might feel miserable because it's painful to urinate, but it's not a severe infection. An upper urinary tract in the kidney, which we call a pyelonephritis, is an infection of an organ, the kidney. That's much more serious. Okay, so patients with pyelonephritis often are sick. They have flank pain. They have a fever. They have an elevated white blood cell count. They can become septic if the bacteria in the kidney goes into the bloodstream. And on top of that, they might have symptoms of a lower urinary tract infection because that's where it started. So they may give a story of having painful urination, frequent urination, because they had a bladder infection, and then the bacteria went from the bladder up to the kidney and caused a pyelonephritis. Okay, so very different conditions in terms of severity. Now, if we talk about a cystitis, that's a bladder infection. You never have a fever with a cystitis. Okay, it never gets into the bloodstream. You can almost think of the bladder as just a storage container for the urine before it exits out of the body. Okay, so it doesn't cause systemic symptoms of a fever or an elevated white blood cell count. Okay, it does give you symptoms of dysuria, which is painful urination, frequency, meaning I'm urinating all the time, and urgency, meaning when I have to urinate, I have to go right now or I'm going to be incontinent. So those are symptoms of a simple cystitis. Urethritis, which is typically an STD, a sexually transmitted disease, is usually caused by chlamydia or gonorrhea, one or the other. And again, that doesn't cause a fever either. Okay, urethritis typically gives you discharge, so urethral discharge in a male, staining of the underwear, painful urination, so it can kind of sound like a bladder infection at the beginning. And so if it's urethritis or cystitis, it's a lower tract infection, typically less serious. Pyelonephritis, more serious. It's a systemic illness with fever, elevated white blood cell count, flank pain, plus the symptoms of a cystitis. Since a pyelonephritis is often from bacteria ascending from the bladder up the ureter into the kidney and setting up an infection there. And remember, when we're talking about cystitis or pyelonephritis, we're really referring to bacterial infections. Okay, so we send off a culture of the urine. Well, first we do a urine dip, and on the urine dip, we're going to see that there's going to be nitrates. There's going to be white blood cells, red blood cells, positive leukocyte esterase, maybe a bit of protein as well. Okay, so the urine dipstick doesn't necessarily tell us if it's a cystitis or a pyelonephritis, but the symptoms definitely do. Okay, and they're both treated with antibiotics. So a cystitis is typically just treated with oral antibiotics. A pyelonephritis just depends on how sick the patient is. So if their vital signs are stable and they're not terribly ill, and they're not vomiting profusely, then we can use an oral antibiotic. If they're very ill with a pyelonephritis, we use intravenous antibiotics. Okay, well, I guess this slide won't have to be very long because really that's what we just spoke about, right? So urinary tract infections can occur anywhere in the genitourinary system, right? So the infection can start in the bladder and it can ascend to a kidney, leading to pyelonephritis. Urinary tract infections are much more common in women. So a simple cystitis is significantly more common in women because the urethra is very short. So the ability for bacteria to get from the outside world to the inside of the bladder is much more easily done in a female than a male. Okay, so it's relatively uncommon for a male to have a bladder infection unless they have some kind of difficulty urinating, such as BPH, and they're not emptying their bladder of urine. So the most common bacteria that causes cystitis is E. coli. Okay, that's the most common. There's other ones as well. They're all treated with different antibiotics. If the infection ascends to the kidney, as we mentioned, it can lead to a pyelonephritis. Okay, and the symptoms of a pyelonephritis are much more significant. So they're all the symptoms of a cystitis plus fever, flank pain, feeling miserable, and potentially very ill if they become septic. Okay, cystitis, the symptoms, as we mentioned before, frequency, urgency, dysuria. In older adults, remember, older adults don't necessarily have symptoms that help us get to the exact source of the infection. So an old patient can present with just confusion and new onset of incontinence. That's it. So they're wetting their pants or they're wetting the bed suddenly and they're confused. There is a condition called interstitial cystitis, which basically is the identical symptoms to cystitis, but it's just inflammation of the bladder. And this occurs in women. There's no bacterial infection. In fact, women often get repeated courses of antibiotics because it has identical symptoms to a bacterial cystitis. But in actual fact, it's just inflammation of the bladder, and it's typically diagnosed with a scope into the bladder called a cystoscopy. Okay, so it's not treated with antibiotics once we make the correct diagnosis. Okay, so how do we prevent UTIs? Well, wiping from front to back is really important in women and young girls. Staying really well hydrated, which will result in a really good urine flow, and a really good urine flow stops bacteria from forming an infection, right? And that's partly why men with BPH that can't empty their bladder, they have stagnant urine, and that's what leads to a urine infection in a male. Okay, so staying hydrated is really important. Urinating after intercourse is a good idea because women are very prone to UTIs after intercourse because there's been movement down there and the urethra is quite short, and there's the potential for bacteria to traverse that short distance and get into the bladder. So some women routinely urinate after intercourse to avoid developing a cystitis. Okay. The other issue that comes up a lot is cranberry juice. And cranberry juice can be used as a prevention. Is there anything special in cranberry juice? Well, there's vitamin C is actually in a lot of juices. So orange juice, cranberry juice, even vitamin C tablets. And vitamin C is actually ascorbic acid. And ascorbic acid goes into your bloodstream. So when you take vitamin C, it goes into your bloodstream and it makes the urine a bit acidic. And bacteria don't typically like to live in acidic urine. So that's often why women will take cranberry juice to try and prevent a urinary tract infection. Once a cystitis has developed, it's very hard to get rid of it without a short course of antibiotics. Okay, sometimes it'll clear with lots of fluids, but most of the time it needs a short course of antibiotics to clear the infection. Okay, so let's talk about urinary tract infections in children. So they're relatively uncommon. They do occur, and when they occur, they usually occur in girls, right? Again, for the same reason, short urethra to get bacteria from the outside world into the bladder. And once they get into the bladder, they set up a simple cystitis, okay? As I mentioned, pretty uncommon, but if it's going to happen in a child, it's typically a female, and sometimes rarely a male. Okay, now some children can have a condition where their ureter, when it comes into the bladder, isn't fully closing as the bladder fills with urine. Okay, and they get reflux of urine back up their ureter towards their kidney, and that's not supposed to happen. Okay, so typically as your bladder fills, the muscle, the trusor muscle of the bladder, compresses on the ureter, and you don't get reflux of urine back up to the kidneys. Some children have slightly abnormal ureters that come into the bladder, and as their bladder fills, they reflux urine back up to the kidney, and they get recurrent pyelonephritis. Okay? And that's a real issue, because every time you have a bout of pyelonephritis, it's a bacterial infection of the kidney, and you injure the kidney a bit. Okay, it's a minor injury usually, but if you have recurrent pyelonephritis as a child, it can lead to chronic renal failure later in life. So if children have recurrent urine infections, we go looking for reflux in the child. So they have a special urinating test where we look for reflux of dye back up into the ureters. So we instill dye into, or a contrast media into the bladder, and we look for reflux back into the ureters. Because it's really important to diagnose that to prevent recurrent pyelonephritis. Okay? Okay, so acute pyelonephritis, we've already spoken about it. It's a bacterial infection of a kidney, usually one. You'd have to be really unlucky to have bilateral pyelonephritis. So it's usually one kidney at a time, and it's usually abrupt onset of fever, dysuria, frequency, and urgency at the beginning, because it started with a cystitis, and then the bacteria went up the ureter to the kidney, okay? And now they have a kidney infection. They feel sick, they're vomiting, they have a fever, they've got flank pain. So a much more significant urinary infection, okay? And finally, with a pyelonephritis, there's the risk of developing urosepsis, meaning the bacteria is now getting into the bloodstream from the urinary tract, i.e. the kidney, and they have developed urosepsis, which is the infection in the bloodstream, now causing systemic inflammation. So you can get hypotensive, tachycardic. You can get really ill from sepsis, right? So these patients need to come into hospital for IV fluids and IV antibiotics. And remember, whenever we give someone antibiotics, especially if they're sick with a bacterial infection, we always get cultures first. So we would definitely get urine cultures on a patient with pyelonephritis, and even potentially blood cultures if they were very sick. Okay, so what's chronic pyelonephritis? It's really just the result of acute recurrent pyelonephritis. So someone who's getting repeated bacterial infections of their kidney will result in chronic pyelonephritis, right? Chronic infection and inflammation of their kidneys. And this will lead to scarring of the kidneys, fibrosis of the kidneys, difficulty of the kidneys functioning, and finally chronic kidney disease. And that's why children that are getting recurrent pyelonephritis, we look for a cause, right? Such as reflux disease, because that needs to be reversed. It needs to be repaired. Otherwise, they're going to go from one pyelonephritis to another pyelonephritis and result in chronic scarring, and then potentially leading to chronic kidney disease. Okay. Now, the symptoms of chronic pyelonephritis, it's going to be basically the same as the symptoms of anyone who has chronic kidney disease. And we're going to go over that on another slide. Okay. So I wouldn't spend too much time with polyuria, nocturia, and mild proteinuria. I mean, we can talk about that a bit. Those are basically just, polyuria means I'm making a lot of urine, or too much urine. Nocturia is I'm getting up at night to urinate. And proteinuria we've spoken about. So why would these be symptoms of chronic pyelonephritis? Well, the nephrons are being harmed every time you get a bacterial infection of the kidneys, and they're running into difficulty concentrating the urine and reabsorbing the fluid because they're being injured, and it results in polyuria, and polyuria at nighttime gets you up a lot, so nocturia, and you could have proteinuria because even the glomeruli can be injured and you can start to lose protein. Okay, but essentially the symptoms are going to be the same as chronic kidney disease symptoms, and we'll come to those on another slide. Okay, here's a question. Questions are always good. So the nurse in the emergency room is working with a patient who has a suspected UTI. What abnormal findings on the urine dipstick should the nurse use to determine the presence of infection? So we went over that slide on what's normal and abnormal in the urine. So leukocyte esterase is an enzyme that's released by white blood cells in the urine, and so that's going to be positive. Nitrates occur from the bacteria being in the urine. There's nitrate production. That's going to be positive. Glucose, no, that shouldn't be the case. Spilling glucose into your urine can be a sign of diabetes because your blood sugar is so elevated. There's so much of it leaking into the nephrons from the glomerulus that it can't all be reabsorbed. So it could be from diabetes, not from a UTI though. Proteins or A and B. So the answer really is A and B, leukocyte esterase and nitrates. You can also have some red blood cells because there's inflammation with a UTI. and you often have white blood cells in your urine with a UTI. And you can have a bit of protein, but it's not the prominent component of the urine that helps us decide if someone has a UTI. It's usually leukocyte nitrates, white blood cells, and some blood. Okay, another question here. You are caring for a patient with a bladder infection. What information is most important to report to the healthcare provider? Dysuria, so painful urination, foul-smelling urine. So a bladder infection often has foul-smelling urine and it's cloudy. Hematuria, a bladder infection can irritate the bladder wall and lead to some bleeding from the bladder wall. So none of those are abnormal for a bladder infection. A fever. You should never have a fever with a bladder infection. A fever in the setting of urinary symptoms is really a symptom of pyelonephritis, not cystitis.